Good evening, everybody. This is Dr. Patmos. It is December 13th at about 6 p.m. Pacific Standard Time, and I am going to attempt to do something uh, that might not be possible, but I'm going to do my best to help explain the United States healthcare system, what's wrong with it, and why it's such a mess, and what we need to do if we have any ever to have any hope of fixing it. First of all, who am I to even be talking about this? Well, I am a board certified general internal medicine physician with nearly 45 years of practice experience. I still work. I am trained in internal medicine and infection control. I also have worked for many years in an executive capacity in healthcare as a chief medical officer, vice president of medical affairs, medical director, and chief executive officer in large integrated health systems. I have a master's degree in management from one of the top 20 business schools in the world, and my area of interest in my graduate program in management was healthcare economics. I've had the opportunity over the past quarter of a century to lecture dozens of times at hospitals, medical schools, and many other venues on the subject of healthcare economics. So I am qualified to speak about this, and I have a unique perspective, having been a practicing physician and an executive, very well grounded educationally in the subject of healthcare finance and healthcare economics. I understand healthcare finance and economics probably better than anybody you know. So here we go in 10 minutes or less. What about US healthcare? Well, first of all, what prompted this was a conversation I had with someone on another social media platform who's expressing support for um, the uh, Republicans in Congress withdrawing subsidies or failing to renew the subsidies for Obamacare. And the person was opining that, why are we paying for people and we're not getting our money's worth and the healthcare system sucks and just agreeing that we should just stop these subsidies and let these people go without coverage. So let me try to help you understand the American healthcare system. First of all, part of the reason we have a problem is that we don't have a healthcare system. A system implies that it's organized and structured from top to bottom, front to back. We don't have that. What we have is a hodgepodge of all sorts of coverages and insurances and different benefits with different kinds of plans and programs all across the country. We don't have a single system of healthcare. We have multiple systems. We have Medicare, which is for the elderly and disabled. And then within Medicare, you can have straight traditional Medicare, which has no utilization control essentially, or you can have managed Medicare, Medicare Advantage, which there has some utilization management controls. We have Medicaid and in California, Medi-Cal. All of the states have Medicaid programs. They're all different from one state to another. It's a shared federal and state financial responsibility, but the coverages and benefits are completely different from state to state as far as who's eligible and who isn't. Then, of course, you have commercial insurance for those of you who have jobs where your employer provides you with health care coverage. You have your choice of various kinds of plans ranging from, HMOs to PPOs and from all sorts of healthcare insurance providers such as Cigna and Aetna and Humana and the various Blue Cross, Blue Shield, all of those entities. Then, of course, you have a whole bunch of people who have none of that. There are a lot of people who work for small companies that don't provide health care coverage. And these folks don't make enough money really to be able to easily afford to go buy insurance because it would cost hideous amounts if your employer isn't covering you and you want to go out and you're a 30 something or a 40 something and you're going to go out and buy health insurance. You could buy a house for what you could pay for health insurance. So for many people who are employed, they can't afford health insurance on their own. Their employer doesn't provide it, so they're the ones who often go uninsured. And so the Obamacare plan was a way to try to provide an alternative for them so they could have insurance and that they would get some subsidy from the federal government based on income. And that now is lapsing, and Trump and the Republicans are refusing to. That's what the shutdown was largely over. They're refusing to fund these subsidies. And so as a result, a lot of people are going to go without coverage, or they're going to see their expenses rise dramatically. The premiums for these, without the subsidy, the premiums for these Obamacare plans is going to really skyrocket. I mean, double or triple or quadruple. So that's the problem, is we don't have a healthcare system. Our quality of our healthcare system in the United States really, our quality of our healthcare non-system really depends upon where you are in your station in life and where you are geographically and financially. If you're on Medicare with a supplement or Medicare Advantage, you have pretty good access to healthcare in most places. Medicaid, you're not going to have very good access because a lot of doctors won't take Medicaid because it pays so little. And if you do have a Medicaid provider, you're not often treated very well. So Medicaid isn't great insurance. It's really uh, rock bottom insurance for people who are very poor. Um, Quality varies widely depending upon, at one end, you can have very good health care in the United States if you're wealthy. If you're not wealthy, good luck. You're not going to necessarily have great health care. We have a big problem with misaligned incentives. People always want to know, why is healthcare so expensive? Well, one of the reasons why is we still are largely a fee for service based healthcare economy, where providers, doctors, and hospitals are paid based on volume and intensity of services. So that provides an incentive to do more and more services, higher, more volume, higher intensity, and that tends to drive high specialty, high reimbursing specialties. Certain specialties make a lot more money than others. Procedural based specialties bring in sometimes 10 times the revenue or reimbursement that a primary care physician might make. So we have misaligned incentives, and we have a very heavily dominant system is dominated by fee for service. We also have a large segment of the country that has capitated managed care. And in capitated managed care, HMOs, costs are much better controlled, like Medicare Advantage plans, because there's tight utilization control over. You can't just go to any doctor you want, and the doctor can't just order whatever they want. It has to meet certain criteria, be evidence based, and be approved. A lot of people don't like that, but unfortunately, it's necessary because a lot of doctors order a lot of things that aren't necessary. And so another thing that drives high healthcare costs is the fact that we have some very significant medical problems in this country. And the most important one is gun violence. This is the most gun violent place on earth. Shootings happen every single day in the United States. I've worked in many, many emergency rooms over the last 50 years, and you spend any time in an emergency room, especially in an urban inner city area, especially at night or on weekends. And we always say, the Saturday Night Knife and Gun Club meets at the ER. I've worked in ERs where cars roll up and they just dump the body in front of the emergency room riddled with bullet holes and speed away, and then we're left trying to save this poor individual. So gun violence and violence in general, we have a lot of it. Most hospitals of any size in urban areas have a significant trauma presence, and a lot of that is gun violence. That's so we're shooting ourselves in the foot, so literally. We also have a big problem with drug abuse and alcoholism and drug addiction, which drives a lot of utilization. And then poverty. Poverty is a cause of healthcare utilization. When people are poor, they can't get good health care. They can't get to the doctor. They can't afford their medications. They may not have coverage. So whatever diseases they have get worse. They end up eventually going to the emergency room where by law they have to be treated, whether they have insurance or not. If you go to the emergency room, the law EMTALA requires you must be treated, no matter whether you're legal or illegal, documented, undocumented, insured, uninsured, rich, poor, doesn't matter. You go to the ER, you will be treated. That is the law in this country. We have a big problem with illogical compensation formulas where certain proceduralists can make literally 10 times what a primary care doctor makes. And it's not justified based on the level of skill of training. Being a primary care physician is extremely hard. You have a very wide, it's often said that primary care doctors, their domain is a mile wide and an inch deep. They have to know a lot about a lot of things and be able to, on the one hand, take care of a child, and then on the other hand, take care of a senior citizen. And then in the next room is a pregnant woman. And then the next room, they might have to do minor surgery. I mean, being a family doctor is really very, very challenging. It's not to say that it isn't challenging to be a brain surgeon. It certainly is. It takes 7 years of training. But is that difference to just does that difference justify 10 times higher income for certain proceduralist subspecialties? I don't know. I mean, that's, but it's a problem because it does drive a lot of doctors into going into these specialties. Most young doctors today don't want to be family physicians or general internal medicine physicians because they're not going to make any money. They're gravitating toward these specialties that are procedural based because they can make more of an income. Our system punishes primary care, which is not good. We need more primary care. We also have a very problem with it. We lack a coherent social political value system regarding care, especially as it relates to the poor and the uninsured. This is the only major developed country on the planet where everybody isn't covered. When I travel to other countries, I talk to people from other countries. They're appalled that in the United States people don't have health coverage. It's really, I mean, you go to anywhere, you can go to even developing nations in parts of the world. You can go, for example, to Belize, where people are all given health care. They all have access to health care. They may not have the fancy hospitals that we have in some locations, but everybody has access. In the United States, a lot of people don't have access. So we might have some fancy hospitals, but if you can't get there and you can't go to them because you don't have any kind of coverage, it doesn't do you any good. And we don't have an ethic or a value system in this country where we care about everybody. The Republicans are very content, at least now, to allow a large segment of the people to go without coverage. And hey, it's no skin off my nose. If they're not covered, too bad. If they're here illegally and they don't have any health coverage and they die, too bad. If they're poor and and they can't afford health care coverage, not my problem. That's a big issue. We're lacking a moral basis that recognizes humanity and the fact that we need to take care of everybody on a human level. It also fails to recognize that you're going to pay for it one way or the other. Even if you don't give people coverage, they're going to get sick. Especially because if you don't give them coverage, you don't have primary care, they're going to get sick. They're going to end up in the emergency room where they have to be treated by law, and you are still going to pay for it. So Republicans are dumb because by stopping the subsidies, they're not saving any money. They may think they are. They're just postponing the spend. It's going to be bigger. What makes more sense? Taking care of a diabetic patient as an outpatient, keeping them under good control with their diabetes and their blood sugars and everything else, keeping all of that under good control as an outpatient, or letting them have no care at all, no follow up, no insulin, no medications, no control. And in a matter of weeks or months, they're going to be in the emergency room with a blood sugar of 700 in ketoacidosis in the intensive care unit. It's going to cost you, the taxpayer, 10 times more. So by failing to provide for health insurance, you're not saving money. You're costing yourself more money because it's going to come back to haunt you in terms of higher taxes. When hospitals incur a loss, they don't just write it off. They pass that loss on to the insured patients. That's why you have aspirins that cost $100. You have another issue with we have a system. Not only do we have fee for service versus capitation, but we also have a problem with for-profit hospital systems and some even investor-owned private equity, really people going into healthcare really to extract profit, that can really harm a hospital because hospitals don't make much profit. And if you have investors who expect to get their return on investment, their return on equity, they may not be able to invest any money into what the hospital needs to stay up to date. And so we have this issue with for-profit, health systems, publicly traded on Wall Street, where profits matter, and because that's what investors expect. And it's legal. It's perfectly legal to have for-profit healthcare. We have a lot of healthcare in the country that's not for profit, but they too face the same pressures. They have to have, no margin, no mission. So there are some bright spots, though, in American healthcare, and where you see good healthcare in the United States is in integrated, highly systematized, integrated health systems. And there are some really standout health systems in this country. Intermountain Healthcare in Utah is outstanding. They lead the nation in quality. There's also health system in Pennsylvania. Geisinger Clinic is awesome. They're highly integrated, big system. They have hospitals, providers, a payer arm. It's kind of all together. My favorite, and where I am personally a patient, is in the Kaiser Permanente Medicare Advantage plan. I can't say enough good stuff about my healthcare coverage. I love it. The doctors are fantastic. Years ago they would say Kaiser doctors, weren't as good at doctors. That's not true. I can tell you from my experience, Kaiser doctors are outstanding. Kaiser hospitals are flawless. I mean, they are spotless and flawless. Their operational model is so superior to most other hospitals. Everything is integrated under one roof. You go from the primary care doctor to the specialist. The pharmacy's right there. Everything's waiting for you. I've had surgery in the Kaiser system. My wife has had surgery. We've been nothing but impressed by how good that system is, and it doesn't really cost us anything. The premium is covered by out of my Social Security. My Medicare premium is taken out of my Social Security. I have a very small monthly copay. For my Medicare Advantage plan, I have no qualms being in a managed care, tightly managed HMO system like Kaiser Permanente. The care is fantastic. On the West Coast and much of the country, Kaiser just trounces the competition. They lead in California, for example, and many Western states. Kaiser leads the marketplaces. They dominate They don't just have a good market share. They dominate in Northern California, Southern California, and often in parts of Oregon and Washington. Kaiser is such a competitor because they have very high levels of patient satisfaction. Patients love Kaiser Permanente. The doctors have very high levels of staff satisfaction and provider satisfaction. You try and recruit a doctor out of Kaiser, good luck. I've recruited hundreds of doctors in my career. You can't dislodge somebody out of the Kaiser system. They won't leave because the benefits are good. They like working for Kaiser. Kaiser's an enormous system. They have their own medical school, their own residency programs. It's really out. So they lead in terms of quality, patient satisfaction, provider satisfaction, but very importantly, they also lead in terms of employer satisfaction because employers are their customers who are buying Kaiser coverage for their employees. And Kaiser just trounces everybody. So I think Kaiser is a bright spot and something that we should all be proud of. What does the future look like for healthcare in this country? Well, it doesn't look good because we can't get over for 50 years. I've been in healthcare now nearly 50 years since I first started in medical school. And we're arguing about the same thing half a century later. And it really gets down to the fact that the Republicans, at least this generation of Republicans, don't understand their ethical and moral obligation to provide care for everybody. The cheapest thing you can do is provide care for everybody, basic primary care for everyone. You can't do that if you don't have utilization controls because you can't let everybody just run amok and order MRIs for tennis elbow. We need to have utilization controls, and that's why utilization management is so important. Utilization review. That's why managed care is important. HMOs are important. But unless you acknowledge that we should morally provide health care for people, we're going to continue to lag the world. We have one of the poorest performances. I think we're 35th of developed nations in overall healthcare quality. We spend a fortune on healthcare in this country. We don't cover everybody, and we have really poor quality in many ways. And that showed up during the COVID pandemic. We led the world in mortality in COVID, in large part because we have such a crappy non-system where people don't have access to care and people aren't getting vaccinated. And that's why we had 1.2 million deaths. I mean, we're an embarrassment when it comes to healthcare. Around the world, the United States is an embarrassment. Other people from other countries look and say, "What on earth is going on in that country? It's supposed to be a great country, and we're just really an embarrassment." So the future doesn't look good, as far as I can tell, as long as we have Republicans who look at healthcare this way. Now, let me tell you, Republicans didn't always look at this. If you go back in history, who was it that signed the law that ushered in the age of managed care and HMOs? That was Richard Nixon. Richard Nixon was a very farsighted, not farsighted. He had great foresight. He was the one who pushed managed care and HMOs. And HMOs, in my opinion, I love them. I think they're great. I think they're a great solution. So what's my recommendation? I've complained a lot and told you a lot about everything that's wrong, and I don't have a lot of hope for the future with our healthcare system, the way we're stuck in the mud now between Republicans who don't want to cover anybody and don't care if you die, and Democrats who do want to cover people. What do I think as a doctor and as a person with a master's degree in management, in medical management? What do I think we need to do in this country? I think the solution to our healthcare problem is to cover everyone, everyone. And these, whether if you need a subsidy, fine. If you don't need a subsidy, then it comes out of your pocket. It comes out of your Medicare, or you pay for it out of your salary or whatever. But if you need support, you have to be given a subsidy. It should be based on financial need. But everybody should be covered. It's the least expensive way to go about it. If you leave people uncovered, it's going to cost more in the long run. So everybody should be covered. And then I really like integrated, capitated, managed care. HMO care. I think once people experience how the high quality of Kaiser Permanente or related or similar systems like that, I think you quickly figure out it's really better. I think that if we were to offer a HMO, Kaiser style HMO care to everyone across the country, we would have better health, better coverage, improved outcomes, higher quality, and lower costs. That's how we can lower costs, is by getting everybody into capitated managed care. HMOs like Nixon, the Republican who started that whole thing with HMOs back in 1970, as he signed that into law. So that's my sort of my 10-minute debrief on healthcare from my perspective. Please feel free to comment, like, share. Um, this is I'm giving you my opinion from someone who's been in the field for half a century, and all I can tell you is that as a doctor and as a patient, I'm very happy with Kaiser Permanente managed care Medicare Advantage plan. Have a great day.